Does BCG vaccination change TB test interpretation? Imagine you get a tuberculosis skin test and see a bump on your arm. You might wonder if it means you have tuberculosis or if it's just from the vaccine you received years ago. The truth is, BCG vaccination can influence how we interpret these tests. BCG, or Bacillus calmette-guerin, is a vaccine given in many countries to protect against tuberculosis. It often causes a positive reaction on the tuberculin skin test, which is the most common screening method for tuberculosis infection. This positive reaction can last for many years, even decades after vaccination. Studies show that people vaccinated with BCG can have skin indurations up to 19 millimeters in size, even long after the shot. Because of this, it becomes tricky to tell whether a positive skin test is due to an actual tuberculosis infection or just the vaccine. Both stimulate the immune system to react to the tuberculin protein used in the test, making it hard to distinguish between the two. The effect of BCG on the skin test tends to decrease over time, but repeated testing can boost the immune response, leading to persistent positive results. Larger skin reactions, like those over 15 millimeters, are more likely to indicate true infection, especially in areas with high tuberculosis rates. In low-risk settings, smaller reactions might be more likely caused by the vaccine rather than infection. To improve accuracy, health professionals often consider the person's age, the time since vaccination, and their risk factors for tuberculosis. For example, if someone was vaccinated many years ago and has a small skin reaction, it might not mean they are infected. But if they have a large reaction and other risk factors like exposure or coming from a country with high tuberculosis rates, further testing is needed. Because BCG can cause false positives, doctors sometimes prefer using blood tests called interferon gamma releases assays. These tests detect immune responses specific to tuberculosis bacteria and are not affected by prior BCG vaccination. They are especially useful in vaccinated individuals to avoid unnecessary treatment. In conclusion, BCG vaccination can make interpreting tuberculosis skin tests more complicated. A positive skin test in someone vaccinated does not always mean they have tuberculosis. It's important to look at the size of the reaction, the person's history, and their risk factors. Healthcare providers will evaluate these factors carefully and may use blood tests to get a clearer picture. If you have questions about your test results, always consult a healthcare professional for personalized advice.